The classic round, the smooth and evenly balanced model. Round breasts are often misunderstood because movies and illustrations simplify them into perfect circles. Real round breasts are far more nuanced. They are evenly full from top to bottom, with a consistent density that makes them look naturally sculpted. They hold their silhouette across positions because the tissue is distributed symmetrically, allowing the breast to stay centered without shifting dramatically. People sometimes assume round breasts are the ideal, but this is simply one of many natural patterns. Youthful tissue, certain genetic structures, and balanced glandular development can create this shape, but it is not exclusive to any body type. Round breasts exist on slim bodies, fuller bodies, younger people, older people, and everyone in between. This shape is not better. It is simply balanced in a way that the eye notices first. The teardrop. Soft, natural, and universally flattering. Teardrop breasts have the gentle slope many describe as naturally beautiful. The upper tissue gradually tapers into a full, rounded lower pole, creating a shape that mirrors how liquid settles in a container. This shape comes from the way gravity, glandular density, and skin elasticity interact over time. When people describe natural breasts, they are usually imagining this silhouette. It is common after hormonal maturation, during pregnancy, or after breastfeeding, as the lower tissue becomes slightly denser and the upper pole softens. This is not a sign of aging or change in a negative sense. It is simply the body redistributing volume in the way it finds most efficient. The teardrop shape looks harmonious under clothing, bras, and in movement. It is the shape designers often use as a base because it works well with almost anything. The east-west, the breasts with strong, independent directions. East-west breasts angle outward, drifting slightly to either side instead of facing forward. This is not a sign of weakness in tissue or an anomaly. It is simply the way the breast base interacts with a wider chest wall or a particular ligament pattern. Many people with this shape report that their breasts feel more breathable, more comfortable, and less prone to rubbing or heat. It is a perfectly functional shape that doesn't require fixing or correction. Sometimes breastfeeding or certain sleeping positions can encourage the outward angle, but most often this shape is simply genetic. Their appearance in clothing can vary, but with or without support. East-west breasts are completely normal and incredibly common. The side set, the elegant wide-spaced architecture. Side-set breasts sit farther apart, leaving a notable space between them even when supported. This spacing reflects the width of the ribcage and sternum, not the elasticity of the breast. This shape gives the torso a lengthened, graceful appearance. Clothing often falls smoothly without central protrusion, and bras create shape by gently guiding the breasts inward if cleavage is desired. People sometimes believe this shape means too far apart, but that idea comes from comparison to narrow bone structures. Side-set breasts are simply positioned outward, like two symmetrical structures that frame the chest instead of clustering together. This architecture is natural and visually striking. The close set, the breasts, who never needed a matchmaker. Close-set breasts rest near the center of the chest, often touching or nearly touching. Cleavage requires almost no effort because the breast bases are positioned closely on the ribcage. This shape can appear on small or large breasts and creates a visually centered, cohesive silhouette. Many tops naturally follow the contours of close-set breasts without structural support, and bras tend to feel snug and stable. Close-set breasts are often associated with symmetry because the eyes read them as balanced. But, like all other shapes, they are simply one version of natural variety. The asymmetrical pair. The sisters who grew at their own pace. Asymmetrical breasts are the most universal breast trait. Almost everyone experiences slight differences in size, shape, volume, or projection. The reasons are endless. One breast may respond differently to hormones. One may develop faster during puberty. One may carry more fat. One may have been favored during breastfeeding. These differences are not flaws. They are signatures. Asymmetry can shift throughout life due to cycles, weight changes, pregnancy, or natural tissue evolution. Some people have minor differences. Others have noticeable ones. Both are normal. Nature does not produce identical duplicates. It produces living, changing forms. The athletic shape. Firmer, flatter, and built for motion. Athletic breasts sit close to the chest wall with less natural droop due to denser tissue composition and stronger underlying muscle tone. This creates a firm, compact appearance that many people mistake for smallness, even though athletic breasts come in all sizes. Because they contain less fat and more glandular or fibrous tissue, athletic breasts tend to bounce less and feel naturally supported during movement. This shape is common in people with lower body fat percentages or who engage in consistent physical training. Athletic breasts are often described as sculpted because their silhouette stays controlled and lifted even without structured support. The bell shape: full below, gentle above, and beautifully weighted. Bell-shaped breasts taper softly at the top and expand into a round fullness at the bottom. This shape is especially common among fuller-chested individuals because weight naturally settles downward, creating a gentle top slope and a generous lower curve. The bell shape is incredibly graceful and drapes beautifully under clothing. It represents the natural distribution of tissue when the breast carries more volume, and it is almost always mistaken for sagging even though it is not. Bell-shaped breasts are soft, balanced, and one of the most common adult shapes worldwide. The relaxed shape: the breasts who have earned their stories. Relaxed breasts have softer ligaments and a natural downward extension that reflects aging, pregnancy, breastfeeding, weight changes, or simply inheritance. Relaxed does not mean worn out. Relaxed means experienced. Skin elasticity varies dramatically from person to person. Tissue density shifts with hormones. Life events reshape the body in ways that don't diminish it. Relaxed breasts have simply lived longer and adapted more. They are the shape of reality, not youth-driven fantasy. The conical: the pointed and structured silhouette. Conical breasts project forward in a gentle taper, creating a slender silhouette that differs from round or teardrop shapes. This shape is common in puberty, as glandular development may not have fully filled out the breast base yet. Many adults retain this shape naturally. The conical form works beautifully under clothing because it minimizes side spillage and creates clean lines. People often mistake this shape as undeveloped, when in reality it is simply the way their tissue organizes itself. Conical breasts are unique, elegant, and historically iconic. Tubular breasts: rare, unique, and frequently misunderstood. Tubular breasts have a narrower base and sometimes a more prominent or puffy areolar region. This shape forms when the lower breast tissue does not expand broadly during puberty. Despite myths, tubular breasts are completely functional. They can breastfeed. They develop normally. They simply have a distinctive architecture. Some people seek surgery for cosmetic reasons, but biologically, tubular breasts are just another healthy variation. Pregnancy and postpartum. Breasts: the master transformers of human development. Pregnancy triggers massive internal changes. Milk ducts multiply, glands enlarge, blood vessels expand. The skin stretches to accommodate rapid growth. The body prepares intensely for feeding, and the breasts become warm, heavy, and more sensitive. After breastfeeding or hormonal shifts, the tissue reorganizes and settles into its new form. This process is not damage, it is transformation. Breasts that have nurtured life carry permanent marks of that process, and those marks are earned. Aging. Breasts: when time becomes the architect. As years pass, collagen decreases, skin loses elasticity, and connective tissue naturally softens. The breast shape changes because every part of the body changes. Bones shift, muscles weaken, skin thins. Aging breasts are not mistakes or failures. They are reflections of decades of cycles, gravity, and life. Breasts are not meant to remain fixed in time. They are meant to evolve with the person they belong to. Weight change. Breasts: the adaptive shape shifters. Breasts respond quickly to weight gain and weight loss because they contain both fat and glandular tissue. Weight gain may increase roundness, fullness, or downward projection. Weight loss may reveal a flatter, softer, or more elongated shape. Both are temporary phases in a long cycle of bodily change. This adaptability is not instability, it is responsiveness. When shape changes. Suddenly the signal that deserves attention. Most breast changes are harmless, but sudden changes can be meaningful: rapid swelling, new dimpling, firmness or hardness, unexpected nipple inversion, redness or heat, a sudden difference in size. These signs warrant medical attention. Knowing your usual breast shape means you can detect changes early. Awareness is not fear, it is protection. The truth about breast shapes. The only conclusion that matters. Breasts are living organs shaped by genetics, hormones, weight, age, pregnancy, breastfeeding, and simple human variation. There's no correct shape, no ideal, no fault. There is only your shape, natural, evolving, personal. The body is not supposed to stay the same, it is supposed to tell a story.